How are you?
Oh, good. How are you?
Good. Crazy day like yesterday?
Totally nutty day.
Okay.
Nutty. You know what? I'm going to turn on my Bluetooth. You're going to lose my video for 2 seconds because I want to
Okay, no worries.
listen on my ear. So, talk amongst yourselves for a
Okay.
bit.
Are you gonna join back in? All right, let's do this again. We're gonna have the mayor of the great city of Burlington, Marianne Meed Ward, on with us.
I'm back.
There we go.
Yeah,
I have a
I'm back.
topic of
That's
filler
better.
content. I have a topic of
Okay.
filler just in case. So,
Oh,
can you hear
good.
me?
What was it? Your menu? Yeah, I can hear you.
Oh, okay. That was about how I went to Costco and I saw the lineup and then I went home.
Good.
Yeah. So I'm not waiting in line. I don't care. I
You
don't.
don't,
I'm not-
you shouldn't have to go anywhere. You can order online from every local store there is, or curbside pickup. That's one of my favorites because I just drive
yeah.
up, call them, they bring it out to my car, and it's awesome.
I'll be honest with you. I don't go very often. I haven't been to Costco. The last time I went to Costco was in Burlington to change my tires. So,
I don't even
but
have a Costco membership.
okay. Well, okay.
I have a I have a small house. I don't have a place to store like 82 rolls of toilet paper, which is the only
Okay.
size they come in at Costco. Anyway,
Well, enough Costco talk. Let's get to the questions. I got a bunch of them. Obviously, you guys are in red alert, red zone, threat level midnight. What does this mean for Burlington?
it means that most of our restaurants, services, businesses can open with some exceptions. And there are precautions, so it's not business as usual. So our restaurants are open, but there is a hard cap of 10
Okay.
inside, which is ridiculous. We think it should be based on capacity. So they did change the capacity restrictions for retail, grocery, big box, but they didn't change it for restaurants. So yesterday at Regional Council, there was a motion put forward that was unanimously supported to once again, we've asked the province before for capacity restrictions across all businesses. We asked again for that, and hopefully they will listen this time and put that in place. So, but still a hard cap in restaurants, personal services. You can go to, so I can get my hair done, but anything that requires you to take your mask off. So any facial services cannot be done, or beard trimming if you had a beard. So there are some restrictions, but for the most part, things are open. The city has issued a press release and put some information on our webpage, burlington.ca, in terms of when recreation programs will start up again. There are capacity restrictions there as well. So best to always call ahead before you come. And our outdoor activities have stayed open throughout lockdown even. And we really encourage people to get out and exercise, still do it safely, and stay away from 6 feet away from anyone you don't live with. So it's okay to go tobogganing, but don't use it as an excuse to socialize with everyone else on the toboggan hill, right?
Sure.
Still important to stay apart. We have our outdoor rinks. People can book their time and come with their families. So there's more stuff to do now, which is great.
Sure. There's the new variant in Hamilton we just heard of. There's variants in Peel region, both kind of right in between, Halton. And I know you've said this before in the past too, in our past interviews, that we're all kind of in this together. We've heard that, but from a geography standpoint, it's we all got locked down together. We should all come out together. Are you worried that Halton is going to be, I guess, okay throughout this? Lack of a better word, okay.
Well, as we've talked about before, we have been beside and between Peel, Toronto, and Hamilton throughout this pandemic. And throughout this pandemic, our health indicators have been much lower. Our infection rates have been lower. Our active case rates, across the board, our health indicators have been lower. And when we went into lockdown, it was because not so much our health indicators, it was because of hospital capacity. So that was
Okay.
kind of a new indicator that was layered in. And at the time, we were approaching 4,000 new infections a day, if you can remember that. And the hospitals all around us were at risk of being completely overwhelmed. And then the hospitals would have to start canceling other procedures, elective surgeries, even critically important care. And that was going to create, obviously, a new health pandemic because people need, people are still getting sick from all kinds of other things. So on that basis, they said until we have to look at a GTHA wide lens on hospital capacity.
Yeah.
And until we get Ontario's numbers well below that spiraling threshold, even if an individual region is below that, we need to bring everybody down. So I fully supported that. The lockdown worked. We're now under 1,000 cases a day, Ontario-wide. Burlington had one new case yesterday, one.
Oh, okay.
I haven't checked the numbers yet today. I don't know if they've been uploaded, but for Halton, halton.ca, you can check those between 12 and 2 typically is when they get updated. We had 32, I believe it was, 32, 38 active cases in the entire city. So our picture on the individual health perspective is completely different than all around us. And the hospital capacity is where it needs to be GTHA wide. So when you look at those two big kind of indicators, absolutely, they looked at the right indicators to determine that we were ready to come out of lockdown. And I will say about the variants, I know folks are very concerned, and we clearly cannot let our guard down on this. If you are following COVID precautions, you'll be that will look after you for the variants as well. So wear a mask, stay 6 feet away from people you don't live with. Yesterday, actually, we heard from our medical officer of health that she is advising people, if you go to a restaurant, the limit is 4 at a table. She's saying, don't go with people you don't live with. So
Sure.
she's saying, please continue to only socialize with members of your own household. If people follow that, follow all of the health restrictions, we will keep our numbers low. And whether it's the COVID regular or COVID variant, if you're protected, you're protected.
I've asked this. Do you think do you think there'll be a third wave? I mean,
Well, that's what the health indicators are, that these things, based on the Spanish flu, which is the most
yeah,
recent major pandemic that we know about, and we have so far tracked exactly with the Spanish flu. So there was a first wave, which was pretty significant. Then there was a second wave, which blew the first wave out of the water, and then there's a smaller third wave, and that's exactly, we've already hit 2 out of 3 of those.
true.
It's possible that a third wave is coming before this virus dies out. But that depends on all of us, right? It depends on all of us taking precautions. But, we've talked about this before. There are people who are essential workers that are going to work every day in warehousing, in shipping, in healthcare, in many, many industries, that because of the nature of their job are coming into close contact. We need to make sure that those people are completely protected within the workplace. When we have seen the kind of outbreaks in workplace settings, and those are mostly, as I say, in industrial sort of kind of workplaces, they're not retail facing. We need to protect those people because what we've seen is they get sick at work, and then they go home, and then their family gets sick, and then it spreads that way. And so we need to protect our essential workers and do whatever it takes. And part of the thing we need to do is enhance sick leave, so that people don't feel that they have to go to work in order to keep a roof over their head and food on their table.
Well, let me ask you this. Obviously, we've heard about paid sick leave for quite a while now, quite a few weeks. Doug Ford said yesterday, maybe just, he said it's a waste of taxpayers' money. So, I mean, because there's already a federal program, that's what he said. What are your thoughts on that?
So the federal program goes this far. We need the sick leave to go this far. So no one level, it's like everything that we do, no one level of government can do it all on their own. And so what's being suggested are not duplicative programs, they are complementary programs, picking up where one level of government leaves off. And you pay it one way or the other. You either pay it in healthcare costs, or you pay it to allow folks to stay home and get healthy. And it's a whole lot more expensive for somebody to be in a hospital bed at $900, $1,000 a day than resting at home.
Good point. Dr. Davila, Dr. Lowe both want the chief medical officer's appeal, and Toronto both want to, I guess, have the lockdown stay till March 9th. Are you going to discourage, if that's the case, are you going to discourage people from, Peel and Toronto not to come west, east, west?
Yeah.
West, sorry.
Yeah, we've had this dialogue, and I know they're concerned about people getting out and about, and the numbers going back up in their regions where the indicators are still high. Our indicators are low, and we've certainly discouraged region shopping and region hopping in the past on multiple occasions. At the same time, it's really important to be said that if a business is taking all of the safety precautions for their employees and any customer who walks in their front door, does it matter whether the person is from Toronto or from across the street in Burlington? If the precautions are there, they protect you. And our businesses, I will say, have been extraordinarily, with a few exceptions, and they know who they are, but for the most part, they have followed the mask rules, encouraged their employees and their customers to do the same, have taken advantage of the close to $250,000 that the city put on the table so that they could put protective equipment and barriers and PPE and all of that stuff to make it safe. They have done their part, and they have kept their employees safe. And when we look at the indicators, still the largest sources of outbreak are congregate living, and to some extent schools and select workplaces, but it has not been retail facing businesses. And I think that's really important to point out that it is it's a different situation for our businesses. So sorry about that. Someone's at the door.
Oh, okay. You can bring him in.
That is my doorbell. No. This is the reality of working from home, folks.
Don't worry, this isn't CP24. We can keep on going.
Good. I can still hear you. It just might be a little distracting for you. Go ahead.
Okay. Yeah. We're talking about small businesses. What are small businesses saying in Burlington in regards to what's going on now? If there's another shutdown, what are they saying?
So they're very happy to be able to be reopened. They have been ready to reopen and do it safely. They did it before when we had the gradual reopening right after the first wave, and they're ready to do it again. And I think the biggest issue, I had a hour-and-a-half meeting yesterday with members of the restaurant and hospitality industry here in Burlington and heard their stories. And some of those businesses we've lost already and they're not coming back. Some are hanging on by a thread and have said, we can't survive another lockdown. And it's the roller coaster of open, closed, open, closed. For their industries, that's really tough because they have to order their food and their drink in advance. They have to get their staffing set up, and it's really disruptive. And so being able to be open with restrictions, open with all of the appropriate precautions in place, that is really the direction that we want to head to keep people safe, because we know we're still in this pandemic for the better part of this year. The vaccines will roll out. We know we have a plan, but it's being staged, and likely it will be the fall before everybody who wishes to be vaccinated. And of course, we've had the delays in the vaccination delivery. So we're standing ready at Halton and at the city to do as many vaccines as they can send us, but we don't have any vaccines.
True.
So the businesses are they're ready to do their part to keep people safe. It's a good business decision as well as an appropriate health decision. No one wants to be the next Spinco. Sorry, Hamilton, but you know, they have every reason, first and foremost, the health of their customers and their employees, but it's also good business, and it keeps them in business if people can feel confident. So one of the key issues that came up from the industry was restoring consumer confidence.
Okay.
And that's the issue. There's now there's a hesitancy, especially with the news of these variants, and it's totally understandable. You know, people are still behaving as if it's lockdown, and that's not a bad thing. I mean, that's, you know, that's their choice. But the businesses have taken precautions. So if you go out, they want to give people the confidence that they will be safe if they go into a business or a restaurant. And so there's some work that's being done to restore consumer confidence, because we'll need that for the next year.
Sure. Is Burlington going to create a kind of a culinary kind of Eat Burlington campaign?
We have the Taste of Burlington campaign. It starts today, actually.
Oh, okay.
So good. Yes, good timing. So
okay.
We've done this forever in Burlington, both a winter Taste of Burlington. It's a fixed price menu at participating restaurants. We do it in the summer, fall as well. So
Okay.
this is the Taste of Burlington winter session.
Nice. How's it changed this year? I guess it's more kind of obviously takeout and then dine in, 10 people, you said?
10 people limit in the entire facility, regardless of how big you are. So
Mostly
that's an issue. Or 4 to a table is also the limit. And at this point, there are no provincial restrictions on who those 4 people are. But as I said earlier, our medical officer of health is suggesting that you only eat out at a restaurant for dine-in with people from your own household. So yeah, there's definitely curbside. You know, a lot of our restaurants that, you know, never did takeout are fancier restaurants. They now do dinners in a box, right? For special occasions, for anything. So you can get all your favorite stuff for pickup, but you can order ahead and get all your favorite stuff. And of course now you can get your alcohol with that too, if you want.
I've talked to a lot of executive chefs, and they all say that the thing they miss the most is plating. They can't plate anymore, right?
Oh, the plating. Yeah.
Right? So, you can't plate.
I appreciate a good looking plate.
Yeah.
I do. The artistry is pretty fun. I just miss my oysters. I
know.
My hand is healed from the last time I shucked a dozen. But
we'll be doing it this year at the end of the year for sure. I'm going to switch gears here. Talk about handguns. I know the feds came out with a new bill that allows municipalities to ban handguns by law to restrict possession. Is this something that Burlington's going to take a look at?
Well, this announcement is so very new that we don't really know what it means. So I know that, you know, we'll look into that, that our staff will look into that. It creates some challenges with, you know, normally municipal bylaws are enforced by our bylaw officers. And how comfortable will our bylaw officers be to confiscate firearms? Right. So there's a lot of questions in, you know, the little announcement and the information that we've gleaned so far. You know, I agree that I totally support controls, appropriate controls on gun possession and gun use and carrying and all of that. I think that has kept us safer as a country. But you know, the potential patchwork that this creates of regulations across different municipalities. I know some of the bigger city mayors where gun violence has been a much more of an issue than here in Burlington or even in Halton. We do not have a lot of gun violence deaths, so we're different than some of the bigger municipalities, but they've been calling for a national strategy, not a piecemeal municipal strategy. So while, you know, typically I welcome any additional authorities for municipalities because we are and should be considered our own order of government and local circumstances matter. There are some issues that really are best handled at a national level.
Sure.
So we're still looking into that. I have heard a little bit from the community A few folks saying definitely do a bylaw. More of our members of our community who are law-abiding gun owners who are saying, you know, there's a lot of red flags about what's being proposed here. So all that to say, before we would ever do anything, we would clearly consult broadly with our community to determine what would be right for Burlington.
What's the situation at Joe Brandt? Are the hospital sites overwhelmed? Are they doing well?
We're doing good. Yeah,
Okay.
I haven't looked at today's capacity numbers, but we're below, you know, 100.
Okay, good.
And but here's the interesting thing. In a non-COVID year, around this time, the hospitals would be overwhelmed with flu.
No.
And what I've seen some recent studies that because of all the health precautions people are taking to protect themselves from COVID, they've also protected themselves from all kinds of other nasty viruses, including the flu. So the flu epidemic is way down this year. So that's great news. So it's kind of one of those interesting situations where normally the hospital situation would be worse right now.
We were talking about vaccines before. We touched on it. Where are the Burlington vaccination centers going to be? Have you guys figured that out?
We got a briefing in camera yesterday on some proposed sites for Halton, so stay tuned.
Okay. Nothing else. Okay.
Stay tuned.
Okay.
It's coming, and we did touch on it briefly in open session at Regional Council yesterday when we got the overall COVID briefing from our medical officer of health and our CAO at the region. And one of my questions was, you know, depending on where some of these facilities are located, it might be easier, say, for some of our folks in the east side of Burlington who are right on the border with Hamilton or right on the border of Milton to perhaps go to one of those places. It might be closer than, you know, a site in Burlington potentially, depending on where they're located. And would that be possible? So stay tuned on a complete answer on that too. But the intent initially was that Halton sites would be for Halton residents, so you could really go anywhere in the region. But stay tuned on that. But that is kind of what's being discussed. So there will be some flexibility, is my point, that you don't just, if you're a Burlington resident, you're not limited to the you know, whatever sites are in Burlington.
Cool. I'll ask that again next week. So
I should know more.
Yeah, okay, good. The city
I
of
should
Burlington.
be able to tell you. I know now, but I can't tell you.
Okay, no worries. So the city of Burlington is commissioning an artist to create a public art piece for Regal Road Bridge.
Mm-hmm.
Tell us about that, and are there any other future art projects in the works in Burlington?
So that is the news that we're asking for folks to give us their feedback. I did notice on social some blowback in the community. Is art really important when we're facing COVID, and what about a donation to the food bank and so on? And so I'll just take this opportunity to say the city has a dedicated stream of funding for art that can only be spent on art, and it's precisely because art is important, culture is important in our community. And, you know, there's a quote from Winston Churchill, who during the height of World War II was asked why there would be any public monies going to arts and culture. And his response, he was always good with the one-liners, but his response was, if we have no art and culture, what are we fighting for? And they were fighting for lots of things, but that's part of who we are as human beings. Art is important, culture is important, recreational programs we've seen that in COVID. We're not just, you know, food and shelter. We are complete human beings that need to be fed in a multitude of ways for our own mental health. And so this dedicated stream of funding that only is ever going to be used for art, we will use for art, including on Regal Road, including during a pandemic. And we will also use other monies to assist our in all of the other ways that we do. You know, we gave $60 million to the hospital of taxpayers' dollars. We've done our share on healthcare. We promote and support charities throughout our community. Individually and corporately, we support them. We gave, as I said earlier, $250,000 to businesses that were struggling. So it's not an either or, is my point. It's a both and all of it's important. And in comparison, the art piece is big compared to all the other things that we spend dollars on. So the proportion is, some people might argue that's still too much. I know there will be folks that argue that's not near enough, but it is proportional. So I hope that gives folks some comfort who are concerned about art in our community.
Great answer. So,
thank you.
And that's all the questions.
That just came to me today. No, I think about these things a lot. So it's the first time I've kind of said it out loud. So there you go.
Good. I'm glad it was
for having me on.
So that's all the questions I have. Anything you would like to chat about, like the Burlington vaccination centers? I'm kidding. But anything else?
We have our budget meeting next Tuesday. So for folks who are interested, the agendas are published, and what you will find are all the suggested either additions or reductions from city council members to shave 1% off the initial proposed budget. So if we are successful next Tuesday in our deliberations and we go with, you know, most or all of those, the total tax impact to residents will be just under 2.5%.
Okay.
So so fairly reasonable, and also adding service. So one of the things we've talked about is that in the pandemic, we saw our demand for certain services go right up. Everything from garbage pickup in parks in winter, which we didn't have scheduled to as high a degree, but now that everybody is out and about and tobogganing and skating and in much higher numbers than they used to because nobody's traveling, we've had to add more garbage pickup service. So everything from that to people are home and renovating. So we've seen a 10-fold increase in building permits, but requests, but we don't have, you know, a 10-fold increase in staffing. So this budget is going to have to address that increased demand for services from our community, while also trying to fill the gap of COVID, which is significant. We have about an $8 million gap between, you know, when you take account of reduced revenues and increased costs due to COVID. So we have redirected some of our capital program funding to fill that, but we're still $2 to $3 million short. And so just yesterday, actually, I penned a letter to Minister Bethlyn Falvey to ask for more money for municipalities. So SCM has asked, Federation of Canadian Municipalities nationally has asked the federal government, the Association of Municipalities of Ontario and the Ontario Big City Mayors have asked the province, saying, thank you very much for what you gave us in 2020, but we're not out of the woods yet and we need funding for 2021. So we'll see where that goes.
The Minister Bethlyn Falvey, that's probably the hardest name in show business right now. Did he get back to you?
I just sent it yesterday afternoon, so I'll give him a little another day or two. I'm sure he will get back to me. They always do. They always get back to me. Yes, I'm grateful for that.
Cool. Anything else?
Oh, we could talk about all kinds of things, but that's.
I think that's all the time
for now. That's all the time we have.
See you next week.
Okay. Thanks. Thanks for accommodating the time. I appreciate it.
Oh, no worries. Take care.
Bye.
Bye.